Hi, this is Emma Krasansky in collaboration with Dr. Christopher Steele, presenting the Health Equity Teacher Module, History of Medical Racism. The objective for this presentation is that by the end, learners will be able to discuss the history of racism within American medicine and its relevance to practicing medicine today. So the way that I'm going to go about this presentation is that I'm going to go about period by period of American history and briefly describe the societal structure and laws of that period, as well as how the presence of racism within those periods in healthcare and medicine. To begin with, we'll start with enslavement. In 1619, the first slaves were brought to North America, to the British colonies in North America, beginning our country's history with enslavement. From the beginning, slavery was legitimized with scientific authority and false sciences to claim that Black people were biologically inferior and physically strong enough to endure exploitation and abuse. And so as a result, these Black populations that were enslaved were essentially dehumanized and used as property by their white owners. I am sure that everyone has learned about slavery before. The focus of this is just to talk about a little bit about the rights of slaves and how it impacted their access to healthcare and healthcare quality. As slavery grew, the laws that took away the freedom of the enslaved also grew. So as the enslaved individuals were trying to get more freedom, they made more laws to take those freedoms away. For example, enslaved people could be bought and sold. Enslaved people could not be taught to read or write. Enslavers could kill an enslaved person who was undergoing correction or discipline, and anyone could kill an enslaved person who had been declared a runaway. These are just a few of the many, many laws that impeded the freedoms of enslaved populations. But what I really want to talk about is the racism that existed in medicine during enslavement. Now, just generally, the health of enslaved people was at the discretion of their enslavers, which is quite dangerous because this power was certainly abused. The enslavers wanted to maximize their profit, their production of whatever their plantation or farm or business may have been producing. And so these individuals who were enslaved did not get proper medical attention. Commonly, their master and their master's wife would be the ones providing them healthcare. They rarely got to see an actual licensed and trained healthcare provider. They also frequently experienced violent medical treatment and experimentation against their will within their healthcare. Some examples of just the disparities and poor healthcare that they received: mothers had to return to physical labor as soon as possible after childbirth. Infant mortality rates were estimated to be as high as 50% at one time. And living conditions of the enslaved populations truly promoted germ transmission and disease within those populations. And then the lack of healthcare allowed those diseases to perpetuate and cause many poor healthcare outcomes for these enslaved populations. Not only was the healthcare provided to enslaved populations generally poor and inadequate, to say the least, enslaved Black people's bodies were also exploited for the development of medical education and medical practice. They had positions that they would specifically hire resurrectionists. Medical colleges would hire them to steal freshly buried Black bodies from cemeteries to use for dissection by medical students and display as anatomical material in those educational environments for them to learn off of. Obviously, there was no consent or no informed consent that we would talk about today in that environment. This is a clear violation of their rights. Another example of this experimentation and exploitation of Black people in enslavement for the development of medical practice is James Marion Sims, who is considered to be the father of gynecology because he developed so many of the tools and practices that gynecologists use today in their practices. He actually created those practices and tools through experimenting and exploiting enslaved women, and did so without anesthesia, without consent, really coercing them into these procedures, arguing that they felt no pain. They were enslaved populations, they don't feel pain, so of course it's fine that we do this to them. Clearly a violation, and a clear example of racism in medicine during enslavement. The next period I want to talk about is post-enslavement. So post-Civil War, the Reconstruction period occurs, and then we have our Jim Crow period. So in the Reconstruction, we have the 13th Amendment outlawing slavery. Slaves become freed, but then they're displaced and now have to integrate into society. To help them do that, we have the 14th Amendment in 1868, deeming Black people citizens and deserving equal protection of the law. And in 1870, we have the 15th Amendment guaranteeing Black men the right to vote. This integration to society with these amendments was not so easy. It's obviously easier said than done. We saw that freed slaves struggled to integrate into society. They were displaced without any resources, without any employment opportunities, education, resources to really become equals with whites. They did not. And then as we transition from the Reconstruction into the end of the 19th century, beginning of the 20th century, we have in 1896, the Plessy versus Ferguson decision that enabled separate but equal, formalizing that segregation was legal and beginning the Jim Crow era of segregation across the country. The other point that I wanted to make on this timeline was that in 1868, we have the Howard University opening its medical school to train Black physicians, making the beginning for Black physicians to be able to practice in medicine. But again, that got off to a very slow start, which we'll get into at the end of the presentation. But I just wanted to mention that. Now, in terms of healthcare, racism within healthcare and medicine during this Jim Crow period, instead, in comparison to the enslavement period, when the enslaved persons were simply dehumanized, in this period, they were now segregated against, and we see structural and institutional racism, as well as interpersonal racism, really start taking part in preventing equity in healthcare for these individuals. For example, states created laws that perpetuated racial discrimination in medical care and prevented Black people from getting the same quality of care as whites, or prevented them from getting any care at all. Because some states made it legal to require a white nurse to care for Black patients. So Black patients, if they ended up at a facility with all white nurses and medical staff, they would not receive care because no one could force those white individuals to care for those Black individuals, and the interpersonal discrimination and racism held by those white individuals towards those Black patients, they weren't caring for them. There were laws making it illegal for white and Black patients to be in the same room, same facilities, same hospitals, segregated. There was white facilities and Black facilities for healthcare practices, and there was a lot less Black facilities for Black individuals than there were for white because of the lack of Black healthcare practitioners, because there wasn't enough educational opportunities for those Black individuals to become healthcare professionals. We also see segregation in entrances and waiting rooms, and laws even allowing treatment for Black people only after all the white patients had been treated. Those are just some examples of the institutional and structural racism present in the laws and legislation during this period that directly affected these Black individuals' health. We also see some more prominent violations and racist actions towards violations of Black people's rights during this time period that have been popularized now, decades and decades later, that we can learn from and make sure that they never repeat again, and that we can put procedures and practices in place to protect the rights of everyone, including our minority populations. So the first is legalization of compulsory sterilization. It was first legalized in 1907, but it wasn't really popularized until 1920s. And then it became very popular and continued until the 1970s. And still, there are still some accusations of sterilization, coerced sterilization, even in the 21st century currently. But these coercive sterilizations were disproportionately weaponized against people of color, vulnerable women. They were not fully informed for the consent of sterilization procedures. They may have thought they were getting other procedures done and ended up being sterilized against their will. So people of color were violated, as well as people with mental illnesses, people who are incarcerated. These vulnerable populations, we see this huge example of racism through the coercive sterilization. Now, another example is the Tuskegee study. So the U.S. Public Health Service Tuskegee study of untreated syphilis lasted between 1932 to the 1970s. So 40 years in which Black men with syphilis were told they were being treated for their quote unquote bad blood, but in reality, these scientists and practitioners were just monitoring syphilis and observing and learning from how syphilis developed, how the prognosis of syphilis in these individuals, without giving these men any cure or treatment for their syphilis, even though at one point during that time period, the discovery of penicillin, the cure for syphilis, was discovered. So we see lack of informed consent, manipulation, coercion here in this study. Another example of racism in this period was the collection of cancer cells from Henrietta Lacks without her knowledge or consent. These cells were then experimented on, reproduced, and disseminated for so many different research studies, some that are still ongoing for cancer. She never consented to the collection of these cells, and she was never compensated. Her nor her family were compensated. While they have recognized and given her credit for it, for those cells, there has been no compensation for the violations of her rights. So now we're getting into the 1960s and on to the present for this post-integration period, because in 1954, we have our Brown v. Board of Education that reversed the Plessy versus Ferguson ruling, making segregation illegal because separate but equal is not possible, because separate cannot be equal. That just makes it unequal by the fact that it's separate. In 1963, we see this more so brought into the world of healthcare with the Simpkins versus Moses H. Cone Memorial Hospital decision that racial segregation in publicly funded hospitals was unconstitutional. And lastly, in 1964, we have the Civil Rights Act, which universally prohibited discrimination in all public places, provided integration of all public facilities, and made employment discrimination illegal. So this huge civil rights movement of the 20th century culminates in the 60s with these court cases and civil rights acts that were passed, which would hopefully make way towards health equity for these populations. But we see that that is not the case. We see that racism in medicine persisted after this integration of the 1960s and continues today because of different forms of racism, all of them that we've already discussed, but specifically biases, discrimination, and stereotypes held by healthcare providers against minorities that lead to poor access to and quality of healthcare. Just as an example, across virtually every type of diagnostic and treatment intervention, Blacks and other minorities receive fewer procedures and poor quality medical care than do whites. And so these biases, discriminations, and stereotypes take different form for different practitioners, but they exist and they still persist decades after the integration occurred. We also see laws, policies, and practices that still perpetuate institutional and structural racism, leading to poor access to and quality of healthcare. A few examples, there's too many to list on this one PowerPoint slide, but two examples that I'll discuss is that the Affordable Care Act, when it came out in 2010, had an optional Medicaid expansion. So states could opt in to expanding their Medicaid eligibility above the federal poverty line, but not all states did. And so we see that the Affordable Care Act did improve health insurance across populations. However, these populations in states that did not opt into the Medicaid expansion have lower insurance rates, as well as those vulnerable populations there, including our people of color and populations of color, our Black populations, are now less vulnerable with not equitable access to these to Medicaid expansion, as well as healthcare and health insurance access as a whole. Another example of the institutional structural racism that still exists today is the use of diagnostic algorithms and practice guidelines that adjust or correct their outputs on the basis of a patient's race or ethnicity. Basically, these algorithms and calculators, you say that a patient is, for example, Black, and it will change the output of this predictor or diagnosis based on that racial input. And as a result, it dictates the patient's treatment and care plans. So it may direct attention and resources to white patients, more to white patients than it does to racial and ethnic minorities. And we see these through many examples, of which I'll discuss in our following presentation. But just off the top of my head, the estimated glomerular filtration rate, we see it in a risk calculator for vaginal births after cesareans. We see it in kidney stone predictors. So many different specialties have calculators that they use, and a lot of them use race correction in places where race correction is not rationalized for, does not have the rationale, does not have the statistical background, and it doesn't have the context that says that there's a mechanism in which the race is causing a change in the outcome. But we'll get to more of that in the following presentation. I did just take you through that period analysis from enslavement to Jim Crow period to post-integration period, and we saw that throughout each, even though the structures of our society changed and evolved, we saw that racism adapted. It adapted to different forms of interpersonal racism, structural and institutional racism, to maintain the health inequities and societal inequities of many other types that exist for our Black and other minority populations. The last point that I want to make before this presentation ends is that in addition to discrimination and racism in healthcare and medical education, we also see lack of representation in medicine. So in 2018, pretty recent data, 13% of the US population was Black. However, only about 5% of physicians were Black. So the Black population is disproportionately represented in our healthcare field, as well as many other minority populations. And we see that the growth is not adequate. So between 2018 and 1900, there was only a 1.3% growth of physicians that were Black. So we see that this data reveals that racism over time still prevents Black populations from entering the medical fields, despite things like affirmative action, things like policy changes and integrations of schools. Despite all these actions in the civil rights movement, we still see huge disparity and lack of representation in field of medicine, which then in turn affects the patient care of populations of color. This pie chart to the right just gives you a population by population breakdown of percentage of all physicians. So we see that the large majority is white, 56.2%. The next largest is Asian with 17.1%. And then 13.7% is unknown. And then very small portions, 5% are Black or African American, 5.8% are Hispanic. We see that there is huge disproportionality in our physician population compared to the general population. That wraps up our history of medical racism. I want to emphasize that this is an introduction and overview with a few handpicked examples and historical context. I want you to get an idea of how our racism today came to be and why it still exists, and so that we have an idea of how we can combat it. But I do encourage you to use the resources provided in our syllabus to look further into medical racism in the past, do your own investigations, especially with racism in your own specialty and how that came to be. Thank you.